Hey everybody, and welcome to this webinar, Communicating Climate Change Through Health, a Perspective from the UN Climate Negotiations. And good morning to those of you in some parts of the world, afternoon and evening to the others. We have a large number joining us from all over the place, so welcome here to this webinar, which I should mention is jointly hosted by the World Health Organization and the Global Climate and Health Alliance. As I said, I am Andrew Schenkel of the Global Call for Climate Action. I'm happy to have three distinguished experts here on the panel with me. Professor Ed Maibach, Mr. Jeff Nesbit from the Climate Nexus, and Dr. Diarmid Campbell-Lendrum. Apologies if I got any of those names wrong. I'm sure you guys can correct me there. All three, including myself, are all in Paris, and we're all running around making things happen here at the COP. And in a moment, I'm going to hand it over to our three speakers. I'm going to introduce each one of them, they will begin to take a few minutes each to talk about their perspectives on this subject from here in Paris. And then we'll move on to some questions from our audience, which we can field on Twitter. And you can do that by using the hashtag #ClimateHealth. So, without further ado, I'm going to get started, and I think I will start with Professor Ed Maibach, who is a world expert in public health and climate change communication. He's a distinguished professor of communication and director of the Climate Center for Climate Change Communication at George Mason University in the United States. Ed, I'll let you take it from here.
Professionals, we have an opportunity to shape how the public and decision makers think about the issue of climate change. That opportunity is really sort of based on the evidence of the past 5 decades of our experience with public health campaigns. Public health campaigns, which can be a really powerful tool for affecting positive public health changes. And really the lesson that we have learned from those many decades of public health campaigns is that the tool that we have available to us here today is the tool of simple, clear messages that we can repeat often through our variety of trusted voices. When we can implement that relatively simple formula, we absolutely know that we can shape how the public thinks about the issue, and ultimately sort of create the political will for policymakers to respond to the issue. So let me just take a minute to talk about what we know about the way the public currently thinks about climate change. I know much more about the way Americans think about the issue than people's in other countries of the world, but I'm fairly confident that sort of what we've learned from Americans is more or less representative of people everywhere. So we've learned that the public tends to see climate change as a distant problem, distant in space. It's not happening here. It's likely to happen somewhere else. Distant in time. It's not happening now, but it's likely to happen in the future. And most important to us on this conversation today, distant in terms of species. It's happening to plants, penguins, and polar bears, not so much to people. We also know that certainly Americans, probably people all over the world, aren't yet connecting the issue to human health. In our survey work, we found that literally not 1 out of 20,000 Americans that we've surveyed over the past 8 years has told us top of mind that they understand that climate change is bad for their health. Yet, on the other hand, we've just completed a survey of thoracic physicians from around the world. We haven't quite released that yet. It's on the eve of release. But what we've learned from those thoracic physicians is that the majority of them, the large majority of them, are telling us they are already seeing the health effects of climate change among their patient population now. So climate change as a health threat, as a health problem, truly is a here and now issue, and it's going to be our collective trusted voices that have the opportunity to introduce that incredibly important point of view to the public. So let me actually suggest 3 specific, simple, clear messages that I'd like you to consider putting your trusted voice behind. Each of these 3 messages are messages we've tested. We know that, in fact, they are helpful in opening up members of the public's minds to the issue, helping them move towards the resolve that this is a problem that we, both individually and collectively, need to take action on. The first message is what I consider a bridging message. It's simply a message to sort of get you in to the conversation as a health professional. The second message is a message that lays out the harm very briefly and ultimately points to the real solution, a collective action solution, the solution that the leaders of the world are in Paris right now discussing. And then the third and final message is essentially the answer to the question, what can I do to help? So it's a message that gives every member of the audience something that they can do. So the first message, that bridging message, is that 97% of the world's climate scientists are convinced that human-caused climate change is happening. And as a health professional, therefore, my task is to figure out what I can do and what we as health professionals can do to make sure that people's health isn't needlessly harmed. I call that a bridging message because it's a way for you to invoke the scientific consensus about climate change, a message that we know, because we've tested extensively, is very helpful in bringing people into the conversation. And as health professionals, that message is also really useful in that you can avoid being drawn into long technical conversations about climate science that you may or may not feel comfortable having, and regardless are off point for you. So by simply invoking the consensus with the 97% number, it allows you to bridge right into the conversation and right into your area of expertise. So the second message is, people's health, we know that people's health is already being needlessly harmed by climate change. Polluted air and climate change are hurting our health badly worldwide, and it's going to get much worse unless the leaders of the world take definitive action to protect our health from climate change. So I urge leaders of the world who are assembled here in Paris to take the necessary actions because our health depends on it. Pretty simple message. This is a human health problem. It's bad already. It's going to get worse unless the leaders of the world take action. So I'm urging them to do so. And then the third and final message I want you to consider is sort of that individual solutions message. Namely, I also encourage every citizen of the developed world, every business, every governor, every mayor, to take action as well. All of us can take steps to protect our health, the health of our loved ones, and the health of everyone on the planet from senseless harms of climate change by doing two things: by reducing energy waste, and by moving definitively away from fossil fuels and replacing them with clean energy, like wind and solar. This is something we can all do today, and if we do, we will all immediately benefit from cleaner air and cleaner water and healthier places to live. So I've asked Andrew and Erica to try to get those three messages onto your screen so you can see them and can consider them, and feel free to modify them as you see fit. But I do wish to reiterate the point that these are messages we've tested. We know they're very helpful in revealing a new side of this problem that most members of the public simply don't know, and bringing people into the conversation on a basis that they not only understand, but they care deeply about their own health, the health of their children, and the health of their loved ones. So back to you, Andrew.
Thank you. That was great. It's always wonderful when someone can break it down into three concise points like there. I think our folks out there in conference call land will greatly appreciate it. Let's move on to our second speaker, Jeff Nesbit. He's the Executive Director of Climate Nexus, a strategic communications group dedicated to highlighting the wide-ranging impacts of climate change and clean energy solutions. Jeff, you have a depth of experience in this world, so I'm interested to hear your take on how we communicate the health impacts of climate change. Take it away, Jeff.
Great, thanks, Andrew. So I'm just going to focus on a couple of things. First, I'm going to draw on some previous jobs I've had. So the Food and Drug Administration, Ed and some others know this. So the crazy idea for the FDA to regulate the tobacco industry was my psychotic idea once upon a time, and we learned quite a lot through the tobacco wars that are directly relevant to the climate right now. First, we had to unmask the confusion around the science of in the tobacco wars. It took quite a long time through the media, but eventually science tends to win. It's just a question of how long it takes before you finally do. But once we were able to, through the media, convince folks that smoking does cause harm, that nicotine's addictive, that the companies that targeted children, it made action considerably more likely. parallels now to that in the climate fight are obvious. It's now obvious, and you can see this with the energy here in Paris, that the science debate is over. Even in the United States, quite frankly, except for among outliers. So there's a direct parallel to the tobacco fight that's relevant for the public health community. The second thing we learned in the tobacco wars is that distant threats simply don't work. You cannot convince a teenager, no matter how hard you try, no matter how hard you try to scare them, to worry about whether they might die at the age of 50. Be one of those, distant threats simply don't work with teenagers. Same thing is true, quite honestly, with the climate threat. Talking about almost no relevance to people. Don't make decisions, gut-level decisions, political decisions. You have to talk about climate impacts that are here and now. And quite honestly, the health threat the climate threat connected to health impacts is maybe the most important thing that we have in our arsenal. And we've been encouraging the health professionals to get in the fight, to join the fight, and to lead rather than follow, because they are such a powerful voice. If climate is perceived as simply an environmental issue or an environmental threat, then we're basically not going to achieve what we need to achieve. So those are most of the 2 points I wanted to make. There are really direct parallels between the tobacco war, and now the climate wars, and the nexus for both those fights is the public health community.
Wonderful. Thanks, Jeff. And we had a couple times, it was a little difficult to hear you there, so you could just check your mic. I think you might have been bumping it a couple times, but we heard 99% of it, and it was all wonderful. But thank you for that. Let's move on to our third speaker, Diarmid Campbell-Lendrum, the leader of the Climate Change and Health team within the Department of Public Health for the environmental and social detriments of health at the WHO headquarters. I think I got that right. Let me know what parts I didn't, but I'll let you take it from here, good sir.
Okay, thanks. So thanks for organizing this. It's a pleasure to speak to you. I think when I was growing up, I always liked the idea of the glamour of being a Paris correspondent, so it's a pleasure to be reporting to you from Paris. In my case, from a secure location around the corner by the bins and the medical center, which is the quietest place I could find. So apologies in advance for any background noise you may have. And thanks very much for the earlier interventions, which I think are absolutely critical to some of the messages that we've been trying to get across from WHO for some time. That we have been pushing this, the evidence that we have that climate change poses fundamental threats to human health. Our Director General, starting about 8 years ago, has described climate change as perhaps the greatest threat to public health in the 21st century. But it's also critically important for us that we have the backing of the health community in engaging on climate change. And we do basically at the government level. We have all of the nations, all of the world's governments through the World Health Assembly have signed quite a strong resolution on climate change and health. So that's basically ministers of health from around the world. But in order to really drive political opinion, you need more than the WHO Director General, the Minister of Health, going to a conference and saying this is important. It needs to be backed basically by a groundswell of public opinion or professional opinion relating to the particular sector. And I think that our interactions with the wider health community have suggested that they do recognize that this is important. That they do broadly, as most citizens do, support action on climate change. But one of the things that they need is basically the mechanism or the convening power to get that voice heard as a wider community, the health community as a whole, speaking up and saying that we need strong action on climate change. And that's our reason for example, launching the WHO call to action on climate change, which I think you can see in the chat box and on the webinar, and also through the reason for working with organizations such as the GCHA to increase our reach to the broader public health community. Not just to reach out, but also for us to amplify each other's voices, to say that the health community as a whole is behind this action. As the previous speakers have said, it's clear that there is no more trusted voice than that of the health community. So it is critically important that that voices heard. And I think the key messages are also important. It has been pointed out that climate change has perhaps for too long been considered as an environmental issue, perhaps an economic issue, perhaps a development issue. But in fact, in the original formulation of the UN Framework Convention on Climate Change, Article 1 talks about the adverse effects that we're trying to avoid from climate change, and health is one of the three adverse effects. Damages to health are one of the three adverse effects that we're supposed to be trying to avoid. So we remind our environmental friends that health is in fact 1/3 of the climate convention at least. So it needs to be maintained as an important motivating argument, because people do when they're presented with the evidence, they do make the connection to climate change. And the risks are important, and they need to be communicated, and we have good evidence on the risks of heat waves, infectious disease, and so on. But we think that it's also important to get across that we can do something about this. You know, those of us who work in health know that it's bordering on unethical to inform people that you have a problem if you're not also informing them that there is a solution to this. So we also point out that through the strengthening of public health systems or the social and environmental determinants of health, we can in fact avoid much of the health risks of climate change, at least in the short to medium term, the next 10, 20, 30 years. There's a lot you can do to protect. But we also point out that you cannot let climate change continue unmitigated out into the future, because you erode the environmental determinants of health. You erode your ecosystem services, fresh water supplies, air quality, and so on. So we do have to stop climate change. And we also make clear another point, which we're starting to see much more strongly now, the very strong health benefits that would result if we put into place mitigation measures that also at the same time tried to promote human health. So we point out that our latest evidence is that air pollution kills about 7 million people every year. That's the largest environmental risk to health that there is. It's comparable in size to tobacco smoking. It's just about as big as any risk factor there is to health. And so if we're able to take the decisions that we need to take to reduce greenhouse gas emissions in a way that also promote health and particularly cut air pollution, then you get immediate and local health benefits. I think that, that Professor Maibach was emphasizing. And so in the last couple of years, we've particularly emphasized this message, that it's the things that we're trying to get done are not just about saving the planet 10, 20, 100 years down the line. They're actually things that will bring you immediate benefits. And just one final point on this. One of the big reasons for objecting to action on climate change is the argument that it's too expensive, that it'll impact the economy to cut greenhouse gas emissions. And of course, it will cost money up front to make that transition. But we also point out that the new evidence that is coming through from the IMF and others is that the health payoffs of cleaner energy decisions, if they're actually factored into these decisions, in many cases actually are larger than the cost of mitigation. So in many cases, it actually pays to take mitigation measures if you consider the health benefits. So we think that as a health community, we have some of the best arguments, basically, to support action in this area. And just one final comment on the negotiations themselves. I think that the overall atmosphere in these first couple of days of negotiations is generally positive, and at least we haven't seen some of the crises that we've seen in some previous negotiations. And we, on behalf of WHO, are mainly just interested in promoting a strong and effective agreement, because that will also benefit human health. But we do also see health references in the negotiations in a way that they were not there a few years ago. So in the draft text at the moment, there's 5 references to health. It doesn't sound like a lot, but in previous negotiations, there were none at all. And we do see them in important places, including the preamble, which is now basically agreed, it seems, that health will be a primary justification. So we'll be continuing to work over the next few days and into next week to present the delegates here with the evidence and the arguments for why not only do we need a strong agreement for health, but also references to health will actually strengthen the agreement and also help the public health community to engage in the future. So I'll leave it at that and hand back to Andrew.
Thank you for that. I think the great irony of this call is it's a climate and health call, and I keep coughing, so give me a second while I drink a water. Seem to have developed the COP21 cough here. So we have a number of questions out there, and for those of you who are out on the Twitter sphere, you can send us those, like I said, using hashtag climate health, or you can enter them here on the question area of the webinar on the right. But for the ones that we have, I'm just going to open this up to all three of you, and whoever wants to jump in, jump in. My question is, can you give any examples of where a health perspective has changed a local action, either adaptation or mitigation? I think we've heard a lot of big picture things. I'm curious if there are any examples that those on the call could draw from. So whoever wants to jump in, I'll let you take it.
Thanks. So perhaps I can come in here. I think that I'm not sure it's a local action particularly, but it's clear that in China, for example, much of the motivation for action to basically to push cleaner energy systems is not coming necessarily from an international obligation to drive down greenhouse gas emissions. Much of it comes from the fact that their air pollution is so high and so, in fact, socially disruptive that the government feels under pressure that it has to respond to the high disease burden and the level of complaint that is coming from the population, and that really is a health argument. It's not so much an environmental argument. It's people feeling that the air in the cities is not safe to breathe. And from our point of view, you know, it's a good thing they're using that argument. It emphasizes the health dimension, but more fundamentally, it's just important that the job gets done. That the decisions that need to be taken to have cleaner energy systems, whatever the motivation for them, we should capitalize on that in order to take the decisions we need to take, both to reduce climate change and also to promote human health.
Excellent. Did either of the others wanted to chime in on that?
Yeah, this is Ed Maibach. I'd love to add an additional comment. It's a little bit dated. It's dated now a bit, but I think it's a really important example, and that is in 2010, the citizens of California put a ballot proposition in place that essentially the measure would have suspended California's climate law until such time that their unemployment rate dropped back beneath 5%. At the time, it didn't look like that would ever happen. I believe it already has happened. But the important part of this story here is that the campaign to defeat the ballot proposition really only had two fundamental messages. The first fundamental message is this is a ballot proposition that is being bankrolled by out-of-state Texas oil companies. Do we really want out-of-state, Texas oil companies tell us what to do? And moreover, suspending our climate law, the real price of that would be the price of our health, the price of our children's health, and that of everybody in California, because it will slow down our progress in cleaning up our air and our water. That ballot proposition went down in flames. That was, again, the fall 2010 election cycle. It was I've been told it was the most decisive defeat of any ballot proposition in America that particular election cycle. So a real strong public health message, ultimately rallying public support for a very strong climate action bill.
So I just wanted to mention there's a phenomenal effort underway in the Sahel region in Africa, where it was announced here in Paris that they're going to a considerable amount of money to continue to build what's called the Green Wall around the desert area that's being impacted right now by climate change and driving millions of refugees out from the region around the world. That's a pretty phenomenal local action that has serious health implications and serious national security implications. So it's the kind of thing that gets overlooked in the discussion. But that's a big deal, and there's a big effort to try to address that in the local region in that part of Africa.
And Jeff, I just want to follow up on that. You talked about the green wall there, but how do we break down the wall of communicating things outside of borders? So not to put you on the spot, but if we, given your experience, how can we give that narrative some traction so we can get not just that one, but other narratives that are outside of the global north so people can relate to them?
And that is a great question. And that's actually one of the big problems that we have with this issue. It's that people tend to stay in their lanes. If you're an environmentalist, you get very comfortable talking about the environmental impacts of something, and you get profoundly uncomfortable when you try to address the national security implications or the health implications or any other implication. So we actually, Climate Nexus, spend a lot of our time introducing communities to each other, introducing the national security community to reporters, to the health community. I think a willingness to listen to the concerns and imperatives in another community that you're not familiar with goes a long way. Reporters do a really good job of that because they have to be empathetic to whoever they're interviewing. The folks who are fighting inside of this issue, inside of this movement, need to have that same sort of empathy for others who may or may not even understand the language that they're using.
Thanks for that, Jeff. Well, we're obviously here in Paris in the middle of the negotiations, and I think, we're at that point where we're all very hopeful, but now as things start to come up, we're getting a little more and more concerned that even if we get a good deal, it won't be a great deal. It certainly won't be a perfect deal. And, with the high hopes that we have, I think there is, for us communicators, the concern that if we don't get the great deal, that there's going to be that feeling of, oh, shucks, what can we do next? How do we insulate ourselves, not ourselves, but those outside of this world from getting stuck in there and, looking beyond what happens here in Paris? Again, whoever wants to jump in, take this bull by the horns.
Terrific. Thanks, Andrew. Terrific question. Psychologists have shown us pretty definitively that when change is too big, when goals are too distant, it's very difficult for people to actually find the motivation to begin the journey. But if, in the words of my friends Chip and Dan Heath in their book Switch, they say if we can just shrink the change, demonstrate that we're already partway to the goal, people it tends to renew their sense of motivation, their sense of hope, their sense of engagement in working towards solutions. So I myself am extremely optimistic that the agreement that is currently being fashioned is ultimately a shrink the change kind of message. We will be much further along as a result of this negotiation, hopefully, than we were even 1 month ago. So by getting us partway there, even if we can debate about exactly how much of the way there we got, it is a wonderful opportunity again to renew people's sense of this is a journey that can be achieved, or it's a destination that can be achieved, and that the COP21 negotiations are a real big step in that direction.
Thanks. I'll add just a little bit, which I think I would certainly agree with the points that have been made, and I think that's part of the tactics that have been adopted in the formulation of this conference. I think after the huge disappointment of Copenhagen, which followed a track of, I would say, amplifying the rhetoric before Copenhagen, all of the build-up to Copenhagen was, we need to do this deal now, otherwise the planet is doomed. And the negotiations were set up in such a way that the negotiations happened in the early part of the 2 weeks, and then all of the leaders flew in at the end, supposedly to sign the agreement. This time it's basically been swapped round. So the leaders were here at the beginning of the conference. They made their big statements. They all said it's all very important. We need to get the climate change deal done, and have basically given that signal and then cleared out to let the negotiating teams and the ministers negotiate. So it's done in an approach as sort of a mandate to get on with it and do it, rather than all of these negotiators negotiating under what happened in Copenhagen. These negotiators negotiating under tremendous pressure because their bosses were going to turn up at the end of the 2 weeks, and they had to have something that their bosses would agree with. Here, they're basically being given the signal to get on, guys, and do it. And so it hopefully this way around it works differently. And I think that there's been a very deliberate decision by the French government to learn from the experience in Copenhagen. I would say that the rhetoric beforehand has been much more incremental and positive, rather than we have to do it to do it now, or everything goes to hell.
Well, Jeff, your take on making sure we don't fall into that rut, as Diarmid said, keeping things from going to hell as they did 6 years ago at COP15.
So I'm actually very hopeful. We're making huge progress. I mean, it's obvious everywhere. One of the big changes that's occurred in the last few years is that this is such an enormous issue. It was really difficult for people, even countries, to get their arms around it. What can we do to make a difference? And what you're seeing in this COP is that nations and subnational groups and businesses and mayors have figured this out finally, which is we're going to do what we need to do in our corner of the world, and that will add up to making a difference. That's a big change here in Paris, and it's true in the health community as well. It's easy for physicians or health professionals to understand it's a one-to-one relationship. They know what it takes to save a life, and they're very comfortable with that. Well, one of the key components of the climate issue is communication about the threat. That's as valid a contribution to this issue as what you actually do about it. And that's something that the health community can do probably better than anybody else on the planet. And we've been missing that. So I think that's, I can't emphasize this enough. We really hope that the health professionals around the world get mobilized around this issue, that the national security leadership does, and that the business community does, because those voices combined with what we're seeing here in Paris will make a difference, and it's going to make a difference in a hurry.
Yeah, no, having been to that COP and this COP, it is very clear that there's a lot more reason to be hopeful, especially with this diversity of voices, including the health community jumping on board over the last 6 years. Once again, I want to kind of pivot back to developing countries, and I want to know, this builds a little bit on what we talked about earlier, but what are the considerations for communicators in developing countries that they need to take into account when it comes to communicating health and climate change kind of as one issue? I don't know who wants to field that one. Diarmid is raising his hand. Is that pointing to somebody else, or is that a volunteer over there?
I wasn't pointing up on the screen towards Ed, but I think perhaps Ed would like to speak as well. I can maybe just take a couple of minutes just to make some comments on developing countries that we work with quite extensively as WHO. I think one of the things that's been very encouraging for us is that some of the developing countries have been some of the fastest to move, most pragmatically to move on this. Up to a few years ago, the African countries that we work with had done very little on climate change and health. Most of the research and development work had been done elsewhere. And just a few years ago, our African regional office said, well, we'll just get all of the health and environment ministers together. We think this is important, and we will just write the plan for how we will increase health resilience to climate change. We need to be more practical. We don't have time to do all of the research. We'll just tell you what you're going to do about it. And in fact, that has been extremely effective. We now see that the INDCs that have been submitted, over half of them do mention health, and a lot of the best developed ones are from the African countries. So they are mobilizing around health resilience. The other argument that we make is that these countries have the opportunity to bypass some of the less than optimal development decisions that other countries have made. The good example is mobile phones in Africa. They hardly went through landlines. They went directly to mobile phones. And I was on a panel on climate change in Africa yesterday, and our other panelists from Africa were saying they're having conversations with their ministers of development who are saying we need to go for growth. I don't care what kind of growth it is. And they're saying no, it matters what kind of growth it is. It matters for health. To put it bluntly, economic growth is extremely important, including for health, because economic growth drives down rates of infectious disease and so on. But on the other hand, there's not a lot of point saving people's lives from malaria if you're going to kill them by air pollution. You do have the opportunity to take cleaner energy decisions, which will both avoid some of these health risks that we have experienced in other countries, and hopefully bypass some of the high energy consuming and high polluting development pathways that are driving climate change.
So I couldn't agree with that more. I'm going to make a prediction. I think you're going to see in across all of Africa, you're going to see a leapfrog technology. You're going to see you're not going to see anybody make mistakes that some of the other developed world countries made, which was to bring power to countries and communities through coal-fired power plants. That's not going to happen in Africa. They're going to leapfrog straight to 21st clean energy technologies, through community-scale solar, through some other very interesting efforts. That's going to have a direct benefit on the health of everybody across the continent. That's a great development, and you're seeing an explosion of interest here from both private and public sector entities who would like to finance that leapfrog effort. That's a great development. It's going to benefit communities, and it's going to have a direct health benefit as well as a technology benefit. And it's great to see.
Right. So everything that Diarmid and Jeff said, I completely agree with, but let me just put a bit of an icing on that point by saying it's particularly our voices as health professionals. We are trusted voices, particularly on the issues related to health. So if we want to make the important points that, yes, of course, we've got to bring electrification to all peoples, we've got to do everything we can to help people out of poverty, but doing it in a way that sacrifices their health is not the solution. So that simple, clear message from health voices is really going to be much more powerful than from many other possible voices, all of whom will be helpful, but our loud, clear voice will be particularly helpful.
Wonderful, wonderful. I have a lot of respect for all three of you because you've decided to combine two of the more complicated communications things. I mean, anyone who's here at a COP right now, with all the acronyms and everything that we're all throwing around, we know that climate communications is incredibly complicated, and then we've decided to combine that with health communications, which we all know can, exponentially complicate that. How do we just simplify it and put it into regular terms? Because, in my experience, at the end of the day, it's the simple messages, the old drill baby drill that the oil company used to use. What's our health baby health message when it comes to climate change? Is it that? I just made it up, but is there a better one than that?
Well, Andrew, I'm not sure if you thought my messages that I led with this morning were simple or complicated, but I certainly strove to make them simple. So let me reiterate them. The first message being the 97% of the world's climate scientists are convinced that human-caused climate change, and so as health professionals, it's our job to figure out how to prevent people's health from being harmed. And we know that people's health is being harmed. It will be harmed much more so going forward. And getting a strong agreement to limit climate change out of the Paris negotiations is the most important thing that can happen. And then finally, there's other things that every one of us can do, whether we're just a homeowner, a renter, a business owner, or whether we're the leader of our city, our municipality, or a state or provincial governor. All of us can take actions to waste less energy and pivot decisively away from fossil fuels and towards clean, renewable energies. Those three messages are about as simple and clear as I'm capable of articulating, and not a one of them invokes anything complicated with regard to climate change. So again, I encourage Erica, if she can, to get those onto the screen so that people can, or to send them out to webinar participants after the fact, so that you've got those. You can consider whether or not those are messages you want to put your trusted voices behind. But they are simple, they are clear, and more importantly, they are tested and shown to be effective.
So I'm gonna give you one. So it's that bridges both. A healthier community leads to a healthier life. It really is that simple. And a healthier community is what climate change is all about. The community can be where you live, but it can also be the broader community. Having a healthier community leads to a healthier life, which is what health professionals tend to focus on. That's the bridge. And if we all start to think that way, it's going to matter.
Thanks for that, Jeff. Diarmid, do you want to hop in there to simplify our simplifications? Ed made it pretty quick.
Yeah.
Jeff made it a little quick. Can you do it in like 3 seconds, I think, to continue the trend here?
I'm afraid I can't, and I certainly can't be drill baby drill. That's really, that's really simplifying. I mean, we do have a series of messages. I have to admit these are not ones that are that are tested, but we have some quite strong sound bites on this. We have our Director General saying climate change is the greatest health threat of the 21st century. We have ourselves and others saying that responding to climate change is the greatest health opportunity of the 21st century. We also point out that a strong agreement here in Paris would probably be the most important public health agreement of the 21st century. So I think we have all of these messages which we will continue to promote. But I have to say, I'm very pleased to be part of this webinar because for a while we've been interested in the science of communication of climate change and health. Because we know there is evidence on what works and what doesn't, and we would like to be, I think, a little bit more systematic in how we tailor our messages in order to have the greatest benefit. The last point is not a soundbite, but we do see signals that leaders are picking up on this. We thought it was quite significant that when President Obama launched the climate change plan or act in the U.S. Last year, I think, much of the messaging, most of the picture stories were coming from the asthma ward of a children's hospital rather than the White House, and so the messaging was about cleaner air for our children rather than it was about saving polar bears by the end of the century. And we think it's something that should be continued to be promoted.
Great. And Edward, I just want to let you know, Erica has confirmed she's going to send out your 3 points to everyone on the list here. So rest assured. We did want to end at the top of the hour here. We have about 10 more minutes there. So let's do one last question for the panel here. And then if we have time left, we can see if anything pops up on the Twitter sphere. But I want to point out that there is life after COP21. And moving forward to 2020 and beyond, I'm curious how the health sector can exert influence to influence a healthy climate and healthy people going forward. So what can we do after the 12th or 13th, whenever this show kind of winds down here?
Well, I'll start off here. This is an enormous issue. It's a huge, complicated issue, and for a number of years it's probably been too big for most people to get their arms around and feel comfortable with engaging on. After Paris, there are going to be lots of opportunities for individuals to engage in this issue. They're going to have a chance to choose to drive an electric vehicle. They're going to have a chance to move into a much more energy efficient home where their utility bills are going to be a lot less. They're going to have a chance to put solar panels on their homes to save money. There are going to be ways that people engage. What's going to be important is that, hopefully you can still hear me, what's going to be important after Paris is that we recognize the opportunity that we have to make progress, both at the individual lives level, but also at the community and even at the national political level. That's going to be the central message coming out of Paris, that we finally, for the first time in history, have a chance to make progress on this very big issue.
All right, so it sounds like we will have jobs after COP21, which is good. Diarmid, I see you putting your finger up there. Let's send it over to you.
Yeah, no, I think it is a critically important question. Again, to go back to Copenhagen, it was basically blowing up a big bubble that then burst in Copenhagen, and it really did set things back, I would say, quite significantly that it was done in this way. So, I mean, it would be interesting to hear more from our communications colleagues on how we transition the messaging after Paris. Because on the one hand, if it were all to fall through, then you get another Copenhagen. You say, well, that climate change thing, it's it's not really working out, is it? What are we going to do about it? The other risk, I suppose, is we do a deal in Paris, and then people say, okay, well, climate change is fixed because we fixed that in Paris. Of course, it isn't. The agreement itself doesn't fix anything. It just hopefully makes it easier for people to carry on fixing it. So I think that's also an important part of the message. It's not the agreement itself which is going to do the job. The agreement should just be the encapsulation and the reinforcement of the collective effort that needs to be made to address climate change. So it is still down to individuals, to communities, to cities and countries to actually do what needs to be done to address climate change. It should just be part of our DNA, I would say, after Paris. But I think it is going to be an interesting sort of implementation challenge for us after Paris, whatever comes out of Paris through our programs and so on. But perhaps more importantly, it's going to be an interesting communications challenge to how we keep this as a really important long-term thing that basically everybody just has to keep working on for the rest of their lives. I mean, I guess disease terms, it's a chronic condition. It's not a disease that you treat and then go home.
Well, Andrew, I love that you're pushing us towards extreme simplicity. That is such a useful exercise. And I have to say, Diarmid's prior point about a strong global climate agreement will be the most important public health victory of the 21st century. That is priceless. I wrote that one down. I'm going to find every opportunity I can to use that. But in terms of post-COP21, I can't get it down to 3 words, drill baby drill, but I think I've got it down to 5 words. Clean energy is healthy energy. And if the public health and medical professionals of the world keep reminding everyone else that that is so, it will be a really important driver to keep moving us away from dirty energy and towards clean renewable fuels, which is ultimately what, that is the destination we need to arrive at as soon as humanly possible. But it will take decades.
Okay, I'm curious here, and maybe it's just because I am the son of a nurse, but the average doctor, the average nurse, the average health professional, we know that they are the trusted voices, the trusted messengers for this. We wouldn't have a security army guy talking about health. We wouldn't have a health guy talking about tanks in their construction. So if I'm an average guy here, an average doctor, an average nurse, what can I do going forward to carry these messages forward?
So I'll start there only because my daughter's a physician, my wife is a physical therapist, and my son's global nonprofit works with every health minister in Africa. So they ask me all the time, what should we do? We help the Lancet Commission.
Hey Jeff, sorry to interrupt. We're having a tough time hearing you there. The last thing I heard was you one-upping me with the medical professionals in your family. Which is appreciated, of course. I think you may just be bumping your microphone up against your lanyard there. Why don't we give it another shot, if you don't mind? Sorry to interrupt. Okay, while we wait on Jeff to sort that out, apologies. Do Ed or Diarmid want to jump in? Sorry for that, Jeff.
So, well, if you're a clinical practitioner and you don't spend your time, interacting with the media, going to testify in front of your, at your state capitol, it can seem like there are no opportunities for you to weigh in, but in reality, there are lots of opportunities. Frankly, all you need to do is raise your hand. By going on record, by working, for example, with your your health professional societies, and letting them know that you're willing to talk about climate and health issues, they will find opportunities to steer the media to you. They will find opportunities to nominate you to testify at a town hall meeting in your home, or at your state capitol. Going on record in terms of writing op-eds or even just blog posts, all of these are important ways that you can raise your hand and be heard as a health professional. lots of organizations, including Jeff's great work and his team's wonderful work at Climate Nexus, they're looking to create opportunities for health professionals to weigh in, but they need health professionals to raise their hands and let them know that, yeah, I'm ready, willing, and able. I've got I've got my talking points prepared, and you create the communication opportunity, and I will be your trusted voice. Well, one last point, and that is we are currently working, my center at George Mason University, we currently have partnerships with the American Thoracic Society, the National Medical Association, the Quad AI, that's the allergy and asthma physicians, American Academy of Pediatrics, and other professional associations, both to assess their members' interest in getting involved in this issue, and we've been overwhelmed by how much interest there is among the members of those professional societies in rolling up their sleeves and making a contribution, and now we're beginning to systematically organize opportunities to sort of use those professional societies at the grass tops level to make sure the health voice is heard, and then identify their members who are willing to get involved. So if you are on this webinar and you want to get involved, I would suggest the most practical first step would be contact your professional society and let them know that you're ready to start preparing yourself to be a spokesperson for the issue.
Diarmid, I'll give you the last word here as we approach the top of the hour. No pressure.
Okay, thanks for that. Now, I'm sorry, I can't lay claim to a proud medical heritage, I'm afraid. I come from a long line of ditch diggers. But I think that I would just be reinforcing the messages that have already come through. It is important for health professionals to speak up sort of individually in their community. I think partly because they're not sort of part of the usual suspects on climate change. You expect to hear messages on climate change from environmental organizations. You don't necessarily expect them to hear them from medical professionals. So my guess is that they will be sort of better received from medical professionals, partly because they're not considered to sort of have skin in the game. And I would also just reinforce the message about organizing collectively at the local level and so on through professional societies, but also make use of the international mechanisms that are now starting to come up. So the fact that we now have a global climate and health alliance, the fact that we have quite big health NGOs, Healthcare Without Harm, HEAL in Europe and others, now starting to engage on climate change, makes it easier, I would say, to link sort of horizontally and internationally, as well as through sort of vertically through professional societies. And there is now, there's a wealth of information out there. There's sort of briefing materials and so on. So I don't think we lack good key messages. I don't think we lack consensus on this. I think there's quite a clear consensus within the health organization. I think what we need to do is just to build up our mechanisms for mobilizing a joint voice on health and climate change.
Wonderful. Well, so we are right at the top of the hour, so we're breaking environmental rules and being quite punctual, especially here at COP21. So I think it's time to wrap this up. I want to thank our three speakers, Jeff Nesbit of Climate Nexus at Maibach, and Dr. excuse me, I told you I had a cough, Dr. Diarmid Campbell-Lendrum. And of course, we should thank our hosts here, the World Health Organization and the Global Climate and Health Alliance. Erica will be sending out all of those 3 points and other information after the call, and just ask all of those who are on the call to take these messages, take these pointers, and use them as we communicate this very important perspective on climate change, not just through to the end of COP21, but beyond it. So thank all three of you, and thank all the folks who are on the call. Have a good day, everybody, wherever you're joining us from. Take care.